The sleep clinic really started as a labor of love, and I'm really proud of it. Could I somehow create the perfect clinic? If we had all the resources in the world, could I create a cutting edge program that completely reinvented how bariatric surgery is delivered? I thought, as a bariatric surgeon who himself has had bariatric surgery, what would I want to see as a patient? So how are we different as a clinic? First, we don't pay lip service to the concept of aftercare. We literally do not let you out of our site for 5 years. We call you, we text you, we video conference you, we see you in clinic if you're local. This year, we've actually started remotely monitoring patients' weight. Literally every time a patient steps on the scale, we see that number. And the goal is to not allow you to fail, period. If at any point we see a patient struggling, we're all over them. The idea is to nip it in the bud before it becomes bigger, not to wait until some previously scheduled appointment in 6 months to see how things are going. And I'm absolutely convinced that this approach is really the key to long-term success for bariatric patients. The surgery is absolutely critical and it's necessary, but it's just the start of the weight loss journey. It's not the end. Second, the level of surgical care and expertise that my patients get, I think, is difficult to match. I've worked for over a decade in the public system and at the lead bariatric center of excellence in Ontario. We do the highest volume of cases in Canada, if not North America. We do gastric bypasses, sleeves, duodenal switches. It's the largest training program in Canada for surgeons who want to subspecialize in weight loss surgery. So I get to teach new young surgeons how to perform cutting edge surgical techniques. And I'm able to take all of this experience and expertise and bring it to the sleep clinic. And I think that's really unique for my patients. And I would say lastly, I think the fact that I've had a gastric sleeve myself is a game changer. I'm able to connect with my patients on a really deep level that's just not possible if you haven't had the surgery. In many ways, I'm their guide. My job is to hold their hand and to walk them through this crazy journey and to never leave their side.